Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Watery vaginal discharge and its causes. Watery discharge is normal and can be a sign of a healthy vagina. The vagina produces discharge to clean itself and also produces more discharge around the time of ovulation. /r/n/r/n. However, if the color or viscosity, thickness, of discharge changes, or clear, watery discharge is accompanied by other symptoms like itching or soreness in the vagina, it may be an indication of a problem for which you'll need a healthcare provider. /r/n/rnrnYakobchukOlenaiStock /Getty Images Plusrnrn Watery vaginal discharge is typically normal and can be due to natural hormonal fluctuations that occur during reproductive processes like ovulation and pregnancy, or during sexual arousal or menopause. /r/n/r/n Ovulation typically occurs halfway through the menstrual cycle, roughly 14 days before the first day of the next period. In the lead up to ovulation, discharge may look similar to egg whites and b/r/n/r/n During the lead up to ovulation, the body makes more mucus than it will following ovulation. This discharge is more elastic and watery than at other times during the menstrual cycle. Some people may choose to wear panty liners during this time. /r/n/r/n When a person is pregnant, the cervix and vaginal walls soften. To protect the womb, the body increases its production of vaginal discharge to help stop infections from traveling through the vagina to the uterus. /r/n/r/n Because of this, there may be more clear or white discharge during pregnancy, and this is normal. /r/n/r/n In the final week of pregnancy, the discharge may change from clear to white to discharge that contains thick streaks of mucus or some blood. /r/n/r/n This is normal and happens because the mucus that has been in the cervix during pregnancy leaves the body as it prepares for birth. /r/n/r/n During sexual arousal, glands in the vagina produce a clear, watery fluid to lubricate the vagina and prepare it for potential sexual intercourse. This discharge is normal and usually goes away within an hour. /r/n/r/n The discharge is typically /r/n/r/n As estrogen levels decline during menopause, the vagina produces less discharge. Discharge may be watery as well as /r/n/r/n Some treatments for menopause, like Osphena, ospemifene, also may increase vaginal discharge. /r/n/r/n Watery discharge is usually a sign of a healthy vagina. But if you have watery or thin discharge with itching or soreness in the vagina, you may have thrush, a vaginal yeast infection. This is a common infection that isn't sexually transmitted and can be treated with antifungal medication. /r/n/r/n If vaginal discharge suddenly changes and has an unusual or foul smell or changes color or texture, this may signal an infection. Infections may include /r/n/r/n If you think you have any of these conditions, talk with a health care provider right away. /r/n/r/n Vaginal discharge is normal and can happen at any time during the menstrual cycle, including /r/n/r/n The average amount of vaginal discharge is about a teaspoon of fluid each day. Watery vaginal discharge is normal and a sign of a healthy vagina. /r/n/r/n If you are experiencing a large amount of discharge, like around the time of ovulation, or you are experiencing spotting, you may want to wear a panty liner for added protection. /r/n/r/n There is no need to worry about discharge that is white or clear, but there are steps you can take to prevent abnormal discharge and protect your overall vaginal health, including /r/n/r/n is not needed to clean the vagina and may actually be harmful. Douches contain chemicals that can disrupt vaginal pH balance and encourage the growth of unhealthy bacteria. They can spread infection to the uterus and increase the risk of pelvic inflammatory disease, PID. If you notice genital odors, wash the outside of the vagina, called the vulva, with gentle soap and water. /r/n/r/n clear. Watery vaginal discharge is rarely a cause for concern. But if you are experiencing excess discharge, or it changes color or viscosity, thickness, especially if it's accompanied by fever and/or pain in the abdomen or pelvis, you should make an appointment with your healthcare provider. /r/n/r/n You should also contact your healthcare provider if you have unusual discharge and think you may have been exposed to a sexually transmitted infection, STI. /r/n/r/n There are some symptoms that may indicate an infection, and it is important to be aware of these. If you experience symptoms, or if they get worse or don't resolve within a week, contact your healthcare provider. /r/n/r/n These symptoms may include /r/n/r/n Watery discharge is usually not a cause for concern and is a sign of a healthy vagina. It can be an indication the vagina is cleaning itself, and can also be an indication of ovulation. If accompanied by other symptoms like itchiness or a sore vagina, it may be caused by an infection or other condition. /r/n/r/n If you develop additional symptoms that concern you, make an appointment to see your healthcare provider. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.